Prescribing a homeopathic remedy based on an isolated physical symptom is often like dropping a single bead of water into a turbulent pool. The input is immediately overwhelmed by the complexity of the system. Without mapping a pediatric patient's nutritional baseline or their socio-demographic realities, treatments frequently fail to establish a foothold in the body. Even when the physical prescription is entirely accurate, if the psychological distress at the root of the condition remains untreated, the physical pathology simply returns. True pediatric pathology does not exist in a vacuum. A child's illness develops precisely at the intersection of their external environment and their internal mental state. Solving these complex cases requires a new, data-driven standard of care, one that measures the internal psychology and the external epidemiology of the patient simultaneously. Dr. M.D. Hasanaziman developed a dual-axis clinical paradigm to close this diagnostic gap. This document, a postgraduate thesis from the Hahnemann College of Homeopathy in London, establishes the first foundational pillar, a rigorous clinical study of the pediatric mind. The second pillar is built on public health epidemiology. This master's thesis details the direct correlation between feeding practices, communicable disorders, and infant anemia within the Jashore district. These two distinct avenues of academic research are fused into a single executable treatment model known as the HRDF protocol. By simultaneously processing demographic data arrays and psychological rubrics, the protocol outputs a single, highly targeted clinical directive. Mastering this integrated framework allows the practitioner to stop reacting to isolated symptoms and begin operating as a comprehensive, predictive clinical strategist. The physical limits of a patient's healing capacity are dictated entirely by their environment. The 2022 public health research in Jashore systematically tracked infant feeding practices, rates of communicable disease exposure, and socio-demographic characteristics across both rural and urban zones. The data revealed a strict statistical correlation between these specific environmental variables and the prevalence of infant anemia. Attempting to treat that anemia purely symptomatically without correcting the socio-demographic root guarantees a clinical failure. The biological deficit will simply recreate itself. This predictive radar chart maps how macro public health data serves as a baseline. By analyzing socio-demographics, feeding practices, and infection risk, practitioners can anticipate pediatric vulnerabilities. Anemia cascades through the system, acting as a negative modifier that suppresses immune resistance. Mapping the epidemiological context is the mandatory first layer of the HRDF protocol. It defines the biological canvas the practitioner must work on. Once the external environment is defined, the focus shifts inward to the psychological root driving the physical pathology. To navigate this internal landscape, the protocol utilizes the MIND technique, developed during the 2014 Hahnemann College of Homeopathy research. This flowchart illustrates the core mechanism, filtering a child's raw behavioral distress through a strict diagnostic matrix to output a precise homeopathic rubric. But identifying the remedy is only half the equation. A parallel track of active clinical counseling is always deployed simultaneously. Administering a remedy without directly addressing the psychological distress through targeted counseling leaves the active environmental trigger in place. Applying this dual-action micro-approach, combining the precise remedy with clinical counseling, dramatically accelerates the resolution of chronic pediatric cases. While the public health data maps the battlefield, the MIND technique provides the precision strike required to trigger profound, lasting healing. Executing this dual-axis approach requires a level of data management and clinical infrastructure that extends far beyond an isolated solo practice. The Homeopathic Research and Development Foundation, or HRDF, provides the institutional framework designed to standardize and scale this advanced protocol. The HRDF Executive Committee actively enforces these evidence-based protocols and manages complex, multidisciplinary clinical boards to oversee severe cases. HomeoCare in Jashore serves as the primary clinical testing ground, utilizing over 12 years of Dr. Hasanaziman's practical refinement. The clinic executes this methodology daily through specialized pediatric outpatient consultations and a secure telehealth network built for expatriate patients. Strict protocol compliance for chronic patients is maintained through digital prescription tracking and a nationwide medicine delivery system. The HRDF framework successfully transforms complex academic research into a highly functional, scalable clinical reality that improves patient outcomes across the country. Currently, there is a severe lack of advanced, continuous training in integrated, data-driven methodologies. Practitioners are often left to operate in isolation. The newly architected HRDF seminar portal was built specifically to solve this educational deficit for practitioners worldwide. The portal features an archive of past mind technique seminars, allowing doctors to review real-world clinical case studies and study precise psychological mapping techniques. An interactive announcements board allows practitioners to track upcoming diagnostic workshops and review specific seminar topics before they occur. The International Seminars module highlights HRDF's collaborative events, directly importing global research standards to local practitioners. Through the course enrollment system, professionals can purchase structured, long-form certification courses covering pediatric mental state prescribing and public health integration. This portal acts as a mandatory professional gateway and a complete educational ecosystem for any practitioner aiming to master evidence-based homeopathy. The ultimate advantage of the HRDF protocol lies in its ability to bridge the massive gap between macro public health epidemiology and micro psychological prescribing. Ignoring either the patient's socio-demographic environment or their active mental state results in incomplete treatment, representing a failure of modern clinical duty. Dr. Hassanazzaman's integrated methodology establishes the definitive required standard of care for the next generation of data-driven homeopathic practitioners. Medical professionals and researchers must access the HRDF seminar portal today to review documented case studies and track upcoming topic announcements. We urge practitioners to actively enroll in the advanced mind technique and public health courses to begin upgrading their clinical arsenal. The future of clinical homeopathy belongs exclusively to those who can master the complex intersection of the mind, the body, and the environment.